We're North East Lincolnshire Mind. We're here to make sure anyone with a mental health problem in Grimsby and Cleethorpes has somewhere to turn to for advice and support. So this project originally started probably about 3 or 4 years ago now. Unfortunately, that funding has gone now, that's finished. What we're looking for is to be able to make the service more sustainable.
80% of homeless people in England reported that they had poor mental health. Mental health issues are deeply connected to the trauma and adversity that people who are homeless face. For the homeless community, access to treatment is still a continuing challenge.
Mind Open, we've got given property from Mind, which we share together, and it's really helping us with our mental health.
Last year I was on the streets for the first time in 20 odd years. Walking the streets for like 14 hours a day. But you got me out in October, my health's gone up, you're getting me sorted out with my drug problem. What more can I say?
Our services are focused on supporting people who may have experienced trauma and adversity, leading to poor mental health.
The demand is changing on top of what we're already doing, because people know of us now, they are coming here as a place of help. And if we can't help them, we generally know how to sample. So we have the local drug and alcohol agency running groups here, NEL, and things of that calibre. We've got the local mental health service running 3 or 4 different groups here.
We also support people if they just come in and they need help with benefits, other services, getting involved with other services such as mental health, substance misuse issues, housing.
We currently employ 3 local people to run the drop-in, outreach and housing services. They have great local knowledge and understanding of the challenges local homeless people face. They also have in-depth knowledge of the local services. The team is supported by volunteers, a service manager and operations manager who ensures safety and support is in place, as well as working at a strategic level to ensure external relationships and partnerships support the service.
What we've been able to do with our homeless hub in North East Lincolnshire is we've been able to create an environment where we can support people to become ready for engagement.
We're currently working with an average 37 clients each month, completing one-off pieces of work, helping to maintain their general well-being, such as getting them in front of a medical doctor, helping to engage with mental health services, making a housing referral, helping them with the PIP applications, and with registering with the DWP for benefits.
The local community, there was a lot of begging, a lot of doorways blocked up by clients, a lot of people walking around the streets and using drugs quite heavily, and it has been stated by the clients, coming here means they don't need to.
In some cases, there is a need to carry out several pieces of work with the same client over the reporting period. Through this service, we help to reduce the stress levels and help improve the client's well-being and health. Over the last 12 months, we have averaged 68 individuals attending the drop-in. 13 of these we currently support to maintain their accommodation, and a further 7 we've supported to find private rental to live independently. We know the number of people needing this service is going to continue to grow as the cost of living crisis continues.
It's needed because it's well researched that the homeless community, particularly in the area that we work in North East Lincolnshire, have multiple complex needs.
These people have nowhere to go.
Just speaking to people just this morning, saying about how important it is and how welcome they feel coming here is part of why they keep engaging. Overall, to continue funding the service with additions, around £500,000 for a 3-year service, and that would fund core staffing. It would enable the service to meet the needs of the community more holistically by being open 7 days a week between the hours of 8 and 8. We think probably where people need it the most. Also some much needed renovations to our building to be able to provide washing areas, a shower, and just continue to make the service more of a hub where people can come.
To ensure the project remains sustainable in the future, North East Lincolnshire Mind will also match fund any investment from the big lottery by investing in property across the local area. This will build our community and increase opportunities for the people who find themselves homeless and in need.
Through donations and assemblies, we are also working with a number of different local schools to help raise awareness of our services and to also destigmatise homelessness and mental health.
Well, I came out of prison in April. I would have been no fixed abodes. Basically, having to scrimp and scrape, using money to get it produced to people with drugs and drink.
It's given me a lot of support. They've got me a bank account. They've helped advise with accommodation when I needed it.
Like appointments, all stuff like that. Used to take me to the hospital and stuff like that. I was nearly dead, and the mine lot took me to hospital, saved my life. If it weren't for them, I would have died.
Where do you think you'd be without the support from East Lincolnshire Mind?
I'd either be back in prison or dead.
I would definitely recommend this service to others.